David Nalo, who has previously served as permanent secretary in the Ministry of Trade and Industry, as well as the Ministry of Planning and National Development, was diagnosed with Hodgkin's lymphoma cancer in February this year. He lost the battle today morning. At his home in Nairobi, a somber mood prevailed as the family came to terms with the death. Medical Services Minister Professor Anyang' Nyong'o, who himself spent several months receiving treatment for cancer in the U.S. last year, was among those who visited to condole the family.
We work together in implementing the economic recovery strategy for wealth and employment creation, and even the beginnings of Vision 2030.
The late Nalo was the third senior government official to go public about the ailment after Professor Anyang' Nyong'o and Public Health Minister Beth Mugo. Prominent people who have succumbed to cancer include Nobel laureate Professor Wangari Maathai, former Kiambaa MP Njenga Karume, NCIC Deputy Chair Mary Anyango, and the late Environment Minister John Michuki's widow Josephine Watiri. And just recently, former Butere MP Martin Shikuku. Well, these are just a handful of known cases in Kenya today. Over 18,000 people from across the national strata die annually according to 2008 WHO estimates. And medical experts warn that the disease is no longer confined to the elderly.
Unlike previously, where we used to associate cancer with old age group, right now we are seeing a lot of young people actually getting cancer.
If you go to Kenyatta, you have patients waiting up to 3 months, maybe even 4 months to get radiotherapy. So that is a very big challenge in terms of resources, in terms of facilities, in terms of access.
If diagnosed early, cancer can be treated with just 5 to 10,000 shillings, but the cost could run into hundreds of thousands and even millions of shillings if left undetected until the late stages.
For example, if you look at the oncologists or doctors who deal with cancer in terms of treatment and radiotherapy, they are not even more than 10 in the country. And we are talking of 42 million people.
Changes in lifestyles is also contributing to steady rise in cases.
Alcohol, tobacco, and we also are suspicious of foods. There are food additives and food colors. There's a concern of water in terms of contamination in this country. There's a concern in terms of quality of food that is grown.
Cancer should not be a death sentence. It's a manageable disease and one can actually come out alive provided they get the right care and the right treatment. But despite efforts to sensitize the public, Kenya lacks a national cancer database that can help in decision-making. There are only 2 centers, at Kemri in Nairobi and the Moi Teaching and Referral Hospital in Eldoret. Recently, President Mwai Kibaki assented to the Cancer Prevention Bill 2012, which aims at boosting access to cancer treatment and care. While this may be a step forward to curbing this disease, its faster implementation remains the thin line between life and death for thousands of Kenyans. Violet Otindo for Citizen Live at 9.